Hi, this is Dr. Scott Young. Hi, this is Dr. Scott Young, and today we're going to do some NESARA shorts. No, this one's going to be more specifically about medical debt. So, I want to kind of explain to you a little bit about some of the medical debt. Now, in 2020, we had $195 billion of medical debt that has been stacked up. Now, there's been some statistics. Now, it's hard to say that which way this would go. As many as 10 to 23% of Americans are sitting in medical debt. They owe medical debt. Now, I'm not sure which way I would go on that one. I probably would lean more toward about 10% of Americans have medical debt. Guys, that's a massive number. I mean, depends on where you would do this. Now, if you have medical debt, what you're talking about is that kind of medical debt. And this is a key element. 23% would be at on September of 22, which means that we're having a rising amount of medical debt. Medical debt. So what happens 10% back in 2020, 2023, what that means is that it jumps on your credit report. Now, medical debt, what happens when you think about that is that we're not talking about how medical debt would actually show up. Is you have let's say you have your Blue Cross Blue Shield or whatever. Okay. So for instance, and let me give you an example of something that happened to me. When I had my miracle healing issue, I have kind of it's a United Health, but it's a different kind of a plan. And it's a $6,000 uh, a plan that that's really hard to get to my maximum area, or it's a $1 million plan, $6,000 minimum just to get up to. But it was $140,000 amount that was hitting to. So I remember seeing that first number 140,000, and I was about spitting nails when I was looking at it. But United Health knocked it down to 23 uh 25,000, and they paid everything but 2,300 or something like that. No, 1,300, and then I had to pay the other 1,300 out of pocket. And so I was like, okay, I can pay 1,300 bucks. So that would be my portion of that amount. Now, remember, and when you look at medical debt, what happens is that they have to bill, 149,000 just to get 25,000. See, that's the sickness of the system. And we've sort of talked about that if you've listened to me in the past, because I'm an audiologist. I've seen what happens, how insurances, what they do to the end provider. And we always want to talk about the greedy doctor. And the reality is it's the insurance systems that are really the sickness of the system. Now, so if medical debt is doing that, now if we're also talking about the person who doesn't have insurance at all, that's another part of the system that is really sick. So people who don't have the ability to go off and spend four, five, $600 a month to get health insurance, and so they are just going, I don't have ability to get it, and then they have this catastrophic issue that might happen, $6,000, $7,000, even a small issue like a broken leg. And so now they got $7,000 and they can't possibly afford that. Well, that just racks up and they throw it on a credit card. And what that does is it goes onto your Experian credit report. Okay. So people kind of ask all the time, would that be covered in NESARA? And the answer is yes, because what that is, and here's what happens. The credit department, that every hospital has a credit department, And so they will first talk to you and see some of these hospitals. I mean, you go in and your child is in the hospital and you have a 30-day event from a child that is born. I mean, you're literally at a $1 million event. I mean, I have a friend of mine who's had, two events with a child, and each one of those events were $1 million events, and each one of them were near bankruptcy events to them, and put them in Medicaid in that way. And that kind of stuff is just can wipe you out with that. So the reality is, does that get paid off with NESARA? Absolutely gets paid off. And it's always been looked at in that way, because especially when it shows up on your credit report. And by the way, they'll ding you on your credit report because they want to show that stuff up. And that's exactly what we want to see, that stuff show up. And that's exactly what the debt jubilee is supposed to show up for, because they're going to ding you in that way. And of course, the credit departments want you to pay $200 a month to do that, but they're going to hit you on your credit report. And so that's the kind of stuff that we want to see. And I believe that that's exactly the stuff we're going to see. So yes, that would be covered in killing off those kinds of debts too. So I hope that helps you out. Subscribe, like this kind of stuff. I'm trying just to answer some of these kind of straightforward questions. Thanks so much.